Visual field opposite to visual fibers. This is the principle. So at the lesion at the level of optic nerve, ipsilateral anopia. Lesion at the level of optic chiasma, bitemporal hemianopia or heteronymous hemianopia. The causes include compression from superior tumor, craniopharyngioma, inferior tumor, pituitary adenoma, cavernous sinus thrombosis, or aneurysm of anterior communicating artery, or third ventricle glioma. Next, at the junction between optic nerve and optic chiasma, here the inferonasal fibers of the contralateral nasal fibers will move upwards like this. So there will be junctional scotoma, that is contralateral superiotemporal quadrantopia is present. Most common cause of junctional scotoma is meningioma. Lateral part of the optic chiasma, binasal hemianopia, it is the rarest form, and 5, 6, 7 optic tract, lateral geniculate body and optic radiation. Any lesion below the optic chiasma, there will be contralateral homonymous anopias, contralateral homonymous hemianopias. How can we differentiate from 5, 6 and 7? Pupil. Pupillary reflex after reaching, that is from optic nerve, optic chiasma and optic tract, it goes to pretectal nucleus. It doesn't go to lateral geniculate body. So there will be abnormal pupil if optic tract is involved. Wernicke's pupil is present in optic tract lesions. Whereas in LGB, lateral geniculate body and optic radiation lesions, the pupil will be normal. Congruity, incongruous in optic tract and lateral geniculate body, and congruous in optic radiation. Optic atrophy is present in optic radiation, because optic atrophy is seen only in optic radiation, because optic nerve is the third order nerve which relies on lateral geniculate body, and from there arises the optic radiation, which is the fourth order neuron. So fourth order neuron, there will be no optic atrophy, no. And then the lesion at 8 and 9. The lesion at 8 and 9. Remember the mnemonic tips. Temporal inferior fibers, pie on the sky, superior quadrantopia. Inferior fibers, temporal, pie on the sky, superior quadrantopia. Actually, from the lateral geniculate body, the optic radiations will be divided into two. One is superior or parietal, Baum's loop, and another one is inferior or temporal, Meyer's loop. So these inferior fibers called superior quadrantopia. And visual cortex, tip supplies the macula, no? Tip represents the macula. So visual cortex involving the tip, there will be contralateral homonymous macular defect. Visual cortex sparing the tip, there will be contralateral homonymous hemianopia sparing the macula. And special types includes altitudinal visual field defects seen in glaucoma, optic disc drusen, and anterior ischemic optic neuropathy.